Good evening, friends. I am Dr. Gangadhar KS, Vice President, Karnataka State Committee of Medical Service Center, a medico-social service organization involving in various type of medico-social activities. You all know that today we are in the midst of a pandemic, Covid-19. From November, December 2019, from Wuhan, the Covid-19 has spread to the throughout the globe. It has spread its tentacles. In India also, we are passing almost 2 lakh people, and the number is increasing. And we feel that today we have to throw light on this subject, particularly the plight of the health personnel in these difficult times. Today we are having with us our state president, Dr. Sudha Kamath. She will speak elaborately on the subject, the plight of the health personnel. And Dr. Sudha Kamath happens to be plastic surgeon, and she has guided many activities of medical service center as well as its movements, and she is a renowned plastic surgeon, and she is an alumni of Bangalore Medical College. I request Dr. Sudha Kamath to take over.
My dear friends, good evening and greetings from Medical Service Center, MSc, Karnataka. MSc has been organizing many such discussions on medico-social issues for the last many years, and many of you would have attended also. But due to lockdown, we are not able to meet all of you. That's why this virtual discussion has been arranged. Friends, first of all, let me pay my homage to all those health personnel who have laid down their lives for the cause of the people, for serving humanity in this COVID-19 management. To just name a few, Dr. Pandey was a pulmonologist from AIMS, Delhi, who passed away. Then there is the sanitation chief from AIMS again, who also passed away. There are staff nurses from West Bengal who fell victim to this pandemic. And there are 3 doctors who passed away from Indore. That way, there are many cases. With heavy heart, we remember them and pay our homage. But all the professionals, they with agony, they are asking the questions. Were this death acceptable? Could they have not been prevented? The question is haunting our minds. Friends, there have been questions raised about the management of COVID and the safety provided to our health personnel. The junior doctors in Ahmedabad, junior doctors from Mumbai, they're all raising the questions. They're saying we are not being provided with quality PPEs and masks and other gears. They are not being provided properly, and even when they have complained of the quality, they have been targeted, they have been tortured. Staff nurses, they have been telling, we are treated as second-rate citizens. They are asking us to use the same PPE what we have used again, and they are telling you purchase the mask, you purchase the gloves. We have been treated very badly. And the pharmacy people, they are saying people are gathering at the drug counters without any mask, without any control. There are lines and lines after them. They might be infected, so they are infecting others and they are infecting us also. There are no more counters, there are no more pharmacies. So these are the issues which are coming to light. And again, what has happened is, according to WHO norms, it is 7 days if they have worked managing the COVID cases, then there has to be 14 days of quarantine. But it's been reduced. Gradually, it has been reduced. It was 7 days management and 7 days quarantine first. Now they are reducing to 5 days work and 2 days quarantine. They are saying it 2 days off. Friends, it is not off. Quarantine is not off. They are they are working in the hospitals, wearing those substandard or whatever the PPEs, and with that PPE it is very difficult for them to manage. 6 to 8 hours they have to wear that PPE because of the cost. The government is not supplying them more number of PPE. So whatever it is there, they have to adjust. They have to wear that PPE. Breathing is very difficult for them, and without any AC they have to manage, and they have been sweating. So the doctors are saying almost 1 to 2 liters of sweat we are losing. We are getting dehydrated. Then they cannot attend to the nature's call. They cannot even take a drop of water. With all this, they are struggling. Then they are put into quarantine, and the quarantine facilities are very poor. They are saying the sanitation is not good, and the food provided is not good. And there are complaints that vegetarians have been offered non-veg food, and they are forced to take it. And if they refuse, or if they complain, they are asked to resign, and they have been abusive. This is the condition, friends, of healthcare personnel, and the government is calling them corona warriors, and banging plates, pots, and telling everybody to go to the balcony and clap, and put off your electricity, and use your torches, use your mobiles, and show your gratitude to them. And petals have been showered to them from the helicopter. So those personnel, they are saying, we don't want all this. We don't want your gratitude. Please look into our safety. Please take care of us. They are appealing. Friends, in this condition, then why is this scenario in India? Why is this happening? So to look into it, if you see that, as Dr. Gangadhar said, the corona started in Wuhan, in China, and China took measures to see that it is contained in Wuhan. It did not go to any other city in China. It took all that measures, but it did not take care to see that it did not spread to other countries. It did not bother, because the China which is there now, it is an imperialist China. So business was more important to it. As we all know, it is competing with America. So he simply let it spread, and then on it started spreading. January 30th, 2020, WHO, World Health Organization, declared it as a global health emergency. Then declared it as a pandemic on March 7, 2020. But what did happen? Did our government take note of it? Did our government take measures to contain it? Sorry, friends, it did not take any measures. It simply let it go. Only when the cases started trickling, then suddenly one fine day, that is March 24th, lockdown was declared. Reacting to this, Sujata Rao, who was an ex-secretary for Health and Family Welfare, Union Health Secretary, she's commented in an interview. She has told that measures should have been taken. As soon as it was declared that is a pandemic, then February onwards, all those people who are coming from abroad, they should have been contained. They should have put into quarantine. And all those infected cases, measures should have been taken. There should have been better surveillance. And people who are epidemiologists and who are in the public health care system, they should have been involved. That is not done. So because of this, the pandemic is spreading. And also she commented that the lockdown should not have been done when there are hardly 500 cases and 10 deaths. So this is how this way you cannot contain the viral spread. And all of us know this virus is no treatment and no vaccine has been discovered yet. And for the vaccine to be invented, it's going to take months, or it may take years also. We all know there has to be animal trial, then there has to be human trials. It's going to take a long time. Then how can we contain it? Only by herd immunity. For herd immunity to develop, we should allow the youngsters, the able-bodied people to get exposed, not deliberately. We are not pushing them to the jaws of death, friends, but it can be contained that way. Only those people with high risk, more than 60, 65 years age, comorbid conditions, and with some other difficulties, we have to take care of them. They had to be isolated. All others, they could have been continued to work with precautions, as we talk about physical distance maintaining, then wearing masks, then washing hands, sanitation, all those things. And also, people should have been told properly. They should have been informed. We should have been open to them and tell them all the details to them so that they would have taken all the care to protect themselves. This way, managing this pandemic could have been controlled better, she's saying. But this does not happen. Because of that, in India, we have now more than 2.5 lakh cases and more than 7,000 deaths. So, what does this show? Does our government care for the health of the people at all? Does it really bother? So, as you see, for decades, not only this government, over decades, health and education have been the least priority for the government. For the health, the budget allocation is hardly 1.3%. Now, why is this happening? So, to see this, we'll have to go back probably some centuries earlier. What was the condition of the health of the people? Now, what's happening? So, just to tell you a few things, the leaders of the country and some of the people, they feel very proud of our glorious past. They feel India had everything. We had treatment for all the diseases. We had known about AIDS. We had treatment for that. We knew everything. So either we have lost it due to some foreign invasion, or the foreigners, the Western countries have stolen our knowledge and they're bringing back to us. This is the impression which has been given. Friends, we shall be proud of the people who have contributed a lot in India. So in 6th century BC, we have Shushruta, a renowned surgeon. Then in 1st century AD, we have Charaka, Vagbata. All of them have contributed a lot to the country, and they have contributed to the health of the people. All that we accept, and we have great respect for them. But friends, the medical sciences or the health scenario, whatever we see, it is not just still waters. Society keeps on changing. According to that, the knowledge has to keep abreast with it. It cannot be the same. Just we take a few decades earlier, when we were in the medical college, what knowledge we obtained then, that so much has changed now. Unless we update ourselves, we lag behind. Then you can talk about, when you think of centuries, you can imagine what would have been the plight. So after Shushruta, Charaka, and so many others, the sciences did not develop due to so many reasons. That was lagging behind. It just stood still, and there were a lot of problems in the country and in the society, and it just continued. And the same problems were there in the West also. They were also victims of superstition, empiricism, and the sciences had not developed. But later in Europe, Renaissance took place. We know about French Revolution and the slogans of liberty, fraternity, and the emancipation of the women, equality. All those slogans, they came, and later a democratic society was established after the changes which took place there. With that, sciences also grew. With the development of physics, chemistry, biology, etc., on the basis of that, medical sciences also grew. So that's why we have the father of microbiology, Louis Pasteur. Then we have Edward Jenner, a father of vaccination. Then we have Semmelweis, who brought about concept of sepsis concept of asepsis in the during deliveries. And then we have Joseph Lister, who brought about concept of asepsis in surgery and other things. So this way, sciences have developed and newer concept of emerged. And these newer concepts, they were brought to India when the Britishers came to India. In that condition, that time, India, the health condition was very, very poor. The people were falling victims to cholera, plague, gastroenteritis, and mainly tuberculosis, leprosy, and mothers, they were dying, giving birth to children, and the newborns were dying. Maternal mortality rate and infant mortality rate was very high. At that time, hospitals based on modern medicines were opened in India. We have renowned people who, for the first time, brought modern medicine to India. We have Dr. Chakrabarti from West Bengal, who was the first modern medicine doctor in India. Then we have Anandibai Joshi, Kadambini Ganguly. They are the ones who went abroad and came with equipped with knowledge. This way, the health scenario of the country started changing. Then we have Ida Skadar, who is the founder of Vellore Medical College. She was a daughter of a doctor who was treating patients. But the women, the lady patient, wouldn't want to go to him. Even if they were in a very dire status, very bad position, especially during labor, difficult labor condition, they would not go to him. She was very much upset about that. She said, then we women have to get trained to treat women of this country. So she got trained and started the hospital. So that's how the health condition of the people started improving and hospitals started coming. At that time, in 1943, in a pre-independent India, Boer committee was appointed. It was the chairman was Joseph Boer. Under him, with renowned people, this committee, it was appointed to find out the health condition of the people here and the health facilities available. They did extensive study. Within 3 years, they submitted the report. The main basic points of the report was, one is to stress on preventive medicine rather than curative medicine, and to have three-tier system of healthcare, public healthcare delivery, that is the primary, secondary, and the tertiary care. And they were LMPs, were called licensed medical practitioners, to replace them with MBBS doctors. And more, he is very strongly he opined that in the country, it is the responsibility of the government to take care of the health of the country, to take care of the health of the people, irrespective of whether they can pay or not. All should get the treatment, and it should be free of cost, and the cost should be borne by the public funding. This is how he said. So based on that, in 1952, in the post-independent India, certain recommendations are taken. All were not taken. A few of the recommendations are taken. So now whatever we see, the three-tier system, it is there, and MBBS doctors are coming out. All this we are seeing. So because of that, there were some good hospitals which started in cities. Of course, they were not available in the district places, not in the villages, but at least in major cities there were good hospitals. I'm not saying they were the best. There were a lot of loopholes, but they were much better than what we see today. There were good clinicians who were concerned about the patients who treated. So all of us during our childhood, our parents, we went to these hospitals. The private hospitals were very few. There were a few nursing homes, and they were also manned by doctors themselves who were concerned. And when there were poor patients, there was concession also. Then we had family physicians who took care of the patients around the area. And they were not just physicians, they were family friends also. Patients went to them and discussed about their personal problems also. And if there is any function in their house or in the community, the doctor would be there. They were almost demigods, the doctors. This was the condition. And some relief was there for the patients. But what happens? Suddenly in 1990s, India became a signatory for the globalization, liberalization, and privatization policies. The whole scenario got changed. From a public healthcare delivery system, the stress went on to privatization, and corporate hospitals started coming up. The nursing homes, they got converted into franchising. The family physicians, the whole breed started disappearing, and the public healthcare delivery system, it was in total shambles. The amount given for that to develop the infrastructure, it was very, very meager. They could not update themselves. And talking about the doctors or the nurses or other paramedicals, no recruitment. Most of the time, it's all on contract basis. Friends, when it is contract basis, we know they will not be able to pay much attention to what they're doing. Always they're looking for better jobs because there is no job security. So this happened. And talk about the materials, the equipments, no equipments at all. Very, very old, outdated equipments in these hospitals. Maybe in a few hospitals they have tried to get them. Otherwise, no equipments at all. In OT, if you go, there are old, rusted equipment the surgeons have to manage. And the patient comes with ECG, comes with, chest pain. There's no ECG, and there is no echo, and any other problem, you know how it is. And even in Karnataka, when we see the ventilators available or the staff available is very, very, very less. Government, of course, it calls upon for recruitment. People are not coming because the facilities are very poor. And what we have seen is some renowned doctors would have loved to serve in the government free of cost to the patient, wanted to render their service. They went to these corporate hospitals because they got better facilities and they could deliver their goods better. So this is the condition of the public healthcare delivery system in the country. And in the best of the times, also this is the worst condition we see. And now there is a crisis. In the crisis period, this whole setup is not able to cope with this overload of patients at all. The patients are coming, there are no test kits. The patients are coming. You are not able to segregate patients, and you are not able to have separate hospitals for the patient. Past 4 months, government could have had set up separate hospitals for COVID only. Instead of that, it has converted. If you take in Bangalore, Victoria Hospital is totally converted into COVID hospital. Then what will happen to the other patients? Where will go? Where will they go? Anyway, I'll come to that little later. This is how they have been managing, and there is acute shortage of hands. So whoever is there, they are made to overwork. According to WHO, more than 4 hours, 6 hours, upon should not be working in this setup. But no, there is no respite for either the doctors, nurses, or paramedicals. They are overworked, they are overburdened, there is stress, mental, physical stress, and there is a risk to their life, so they are worried about it, and they are away from the family. Because of all that, there's a lot of mental turmoil, and there is no counseling for that. And if there is any complaint, then, as I said, there is targeting. And one video we saw of one Dr. Sudha from Vizag Hospital, because he complained that the standard PPE is not given, he was suspended from service, and in broad daylight in the street he was beaten up by the police. And the police said he's mentally deranged. But even if he's a mentally deranged, maybe because of a suspension he might have got, or we don't know, he may be just targeted, and they might be simply telling that he's mentally deranged, he's beaten up. This also is treated. And among the public also, proper knowledge is not given. They're anxious. They feel any doctor who comes to our locality or who's in our building, we will get the disease. So because of that, one renowned surgeon, neurosurgeon from Chennai, who died because of COVID-19, his friend and some of them in the ambulance, when they carried him to the cemetery, he was not allowed there. He had to take him somewhere else, and he himself had to dig the grave. Can you imagine the plight of a doctor who had to bury his own colleague? Does it not hurt us? Should doctors be treated like this? But this is happening. And in apartments, what's happening? I have friends who are telling me in the apartments, the other occupants, they feel they are carrying the disease and they may spread to them, so they have been treated as untouchables. Recently, I saw over the TV in Mumbai, in the apartment, they have made a rule. The doctors or the other paramedicals who are treating, they should find a temporary arrangement. So this way, there is ostracization in the society, as if there are some untouchables. So all these things are going on in the society without giving recognition to the service rendered by the human service rendered by the doctors and other paramedicals. All this, it is because of gross negligence of the government and the authorities to pay heed to the warning. Had they taken proper measures at that time, had they employed more doctors, and had they taken the private healthcare into their confidence and demanded they allot some beds for management, this wouldn't have happened. In Spain, they coordinated with the corporate sector and took some of the hospitals for a limited period. There, the beds will be given for the COVID patient. It could have been done here also, because most of the corporate hospitals, the government has given them a lot of subsidy. It may be the land or it may be the tax. The corporate sector owes it to the public to render service. Yes, they are rendering service, taking money. What happened when the test kits were not available? Government requested the private labs and the private hospitals to do it, but for a price. They said, we are putting a tab on that. For 4,500 rupees, you do it. But that much money also who has got? And any person is suspected of uh, COVID-19 is not a deceased person. He is only suspected. The fear is he might spread to others. Now, why should a person spend that much money to see that he doesn't spread to others? I mean, it is logical. If I have a disease and I will have to spend, I mean, I have no other choice. But to see that it doesn't spread, it requires a high degree of culture and standard, and that standard has to be shown by the government also. And that government doesn't show it, how does it expect the people of the country to show that standard and spend from the pocket and get it done. So this is not happening. And this is the condition in the when the quarantine period was reduced from 14 days to 2 days. The doctors have gone to the court, and the Supreme Court has asked the government to reply. You know what the government said? It said we have given PPE, so they'll be able to manage, and we need not follow WHO guidelines always. We can follow somebody else's. So they're following some Atlanta or some American guidelines. And doctors, they're not more exposed to COVID-19 than commoners. Can you imagine who are those people who are talking like that? I do not understand. The doctors who are day in and out sitting and getting exposed to COVID-19 are the same as common people, is it? Especially when there is aerosol producing technology, techniques, either in the ICU or in the operation theaters, the surgeons, anesthetists, intensivists, are they not exposed to corona more? Should more care be not taken? Should they not be given more of a quarantine time? But government is not bothered about it. And one more point is, government, now the whole pandemic is become corona everywhere. What about the other diseases? Suddenly the country has become free from tuberculosis, from malaria, from measles, or cancer, everything. What about the patient? For some time they put up with it. They said, okay, make some online consultation. Can this be done all the time? Patients require treatment. They have to go to hospitals. So where are the hospitals for them? And some of the nursing homes who opened and treated the patients, suddenly they found that there is one corona patient and they locked down the nursing home. So now they are afraid to treat any patient. This is the condition. And there are no proper guidelines to conduct surgeries. Emergency surgeries or elective surgeries, no proper guidelines. So they do not know what to do. Then there are cancer patients who require treatment. No importance is given to them. And what about vaccination? The children who are vaccinated, they have been freed from so many of those communicable diseases. But now again, it's going to shoot up. There are going to be a lot of cases of measles. There are going to be a lot of cases of polio. How is government able to handle it? The government has to answer that. And coming to the health workers, another important section of the health workers is ASHA workers. They are the ones who is doing surveillance. They are the ones who are going home, from home to house to know the condition of the people there, to identify. They're walking in the villages, they're walking in the forest, and they're rendering human service. But these ASHA workers, they're treated very badly by the government. They're called voluntary, it is called voluntary work, and therefore they're giving some honorarium. They have been fighting for their rights, fighting for regularization of their service, and regular salary, it's not been given. Even in this condition, should they not be given some incentive or some risk allowance? Even once upon a time, for the doctors who worked in TB wards, or who looked after the TB patients, or who were in the X-ray department, they were given risk allowance. But all that is withdrawn now. So for all this health personnel, I feel they should be given some allowance. Instead of that, government is, especially those governments are when the DA is withdrawn for them. They are not giving DA for 1.5 years. So this is the, the reward they are getting for selfless service. I feel they should be given all these, benefits, and the demand should be met. From MSC, we are demanding certain things. That is to establish centers to handle corona-related cases, survey, preventive measures and documentation, and research at all levels. To have dedicated hospital and wards with dedicated doctors, nurses, and health workers. To have separate medical staff at the sub-centers and village health centers. To improve infrastructures at sub-center, PHC, CHC, and to arrange for conveyance for all the health personnel, because they are finding it difficult. They are sharing. They are not able to, most of them, they don't have their own vehicles, and they are not able to travel in the public vehicles, and many times they are held up in the hospital. There is no fixed time for them. So provision has to be made for that. And health budget has to be at least 10% of the GDP. These are the demands, friends, we are raising, and I wish that all of you join your voices in raising the demands, so that the government will be able to take care of the health of the personnel who are the caretakers of the health of the country. Only then these calamities can be avoided. Only then we can save precious lives. I think the government owes to the health personnel these measures to stop such tragedies. Thank you.